Welcome back to the Talk Healing to Me podcast. I am your host, Karen Dwyer. This minisode is short, sharp, and packed with value, where I share the top 10 takeaways from my recent conversation with Dr. Kelly Blodgett. His new book, Feel Whole Again, is shaking up the way we think about healthcare, and I want you to hear the insights that really hit home. So these really are they're practical and powerful shifts that you can use right away in your own healing journey, whether they're related to dentistry or not. Any other health appointment, these are relevant too. So grab a notebook and let's just land with these takeaways that could change how you approach your health. This podcast is for educational purposes only and is not medical advice. Always consult your doctor. Views shared are personal and not a substitute for professional guidance. The first one was honor the patient's truth. So your story is data. So the late nights, the stress, the gut feeling that something's off, none of that is fluff. And when providers slow down and really listen, patterns emerge, and that's where better decisions happen. So maybe try, before an appointment, write a one-page health snapshot. I like to write things in my notes in my phone so that I don't forget to bring things up, because I don't know about you. Sometimes I go in, I'll talk about one thing, or the doctor might ask me questions, and then I'll come out and go, shit, I forgot to say about X, Y, or Z. So I in my notes on my phone, you can put a little tick box thing beside them, and I make sure that I tick them off before I go so that I future proof and make sure that I have them done. I'll also make sure that there's, my top three things that I want to think about, because sometimes I might be thinking about something for a few months, and it might not warrant a doctor's visit solely just for that, but maybe make whether it's in a notebook or a diary or in the notes on your phone, if there's something that is bothering you, keep it down so that when you visit, you know what your goals are for that, and that you make sure you get everything covered. The second point was words create power or they take it away. So the word needs shut you down. So options opens you up. So what Dr. Kelly Blodgett said was language sets the tone of your care. So when the provider switches from you need to do this, and instead they say here are your choices, that the practitioners move from a passenger to the driver's seat. And so I suppose from your point of view, if you do hear a doctor say to you, you need to do this, it's really okay for you to say, well, what are my options? Or can you walk me through the pros and cons of that, and how that aligns to my goals? And I'm going to give you an example of this. This might be a little bit too much information. I was at my doctor's recently because I noticed that I had some acne and bloating and it wasn't really going away. And so I got a full hormone panel done and my full bloods. And when I recognized that my progesterone was like through the floor, and what we were going to do was replace my Marina coil, which is uh, for contraception, but also to balance out hormones as well. And when I did a little bit of research and asked some further questions, that can actually bring on more acne and more weight gain and more bloating. And when I got really clear on what my goals were, it's not actually what I need. So I was able to go through some different options. But had I just said, yes, okay, I'll just do that, I wouldn't have had the opportunity to explore what other things to do instead. And if anybody wants to talk further or wants more information about what I am doing, I will do another episode on that. Maybe just email podcast@talkhealingtome.com and I can share my findings from a few different doctors that I've spoken to since. So, next point, if that was TMI, I'm sorry, but I'm always going to be real with you. Um, Point number three, feelings are real data, so use them. So, fear, shame, anxiety or hopelessness, they aren't flaws, they're signals. So, if you're bracing every time you see a provider, your nervous system is telling you something vital. So, maybe after each appointment, rate your experience. How did you feel? Did you get the clarity? Did you get the hope? And if anything scores below a seven, note why and maybe plan your next question, or maybe you have permission to go a little bit further and ask more questions or for a longer appointment. But really make sure that you're sharing how you feel. Sometimes you can just show up and say, okay, this is how something is presenting physically, but it's really important to bring the feelings into it as well, because they can be directly related to the physical symptoms. The fourth one was time is medicine. So healing hates hurry or rush. So a 2-hour intake isn't indulgent, is what Dr. Kelly Blodgett said. It's effective. And one of the things they do is on a Monday, they only take in new patients. And I think they only speak to 7, if I remember correctly, new patients. And they will spend hours with a new one, finding out what their needs are. Now, in, your general practitioner or your physician practice, they usually maybe have 7, 10, maybe max 15. So maybe when you are scheduling something, and if it is something bigger that you need to talk about or you're worried about, maybe ask how much time is allocated for this discussion. If it's under 15 minutes, you can request a longer slot or a dedicated consult. The fifth point was listening often reveals the diagnosis. So you're the only one that's in your body 24 hours, 7 days a week, and your pattern recognition beats any rushed exam. So when someone really listens, the mystery often shrinks. But also, maybe making a note or journaling. And I'll be really honest with you, and even though I've published a gratitude journal, I flippin' hate journaling. Um, I like the after effect of doing it, but the thought of doing it is a real effort for me to sit down. I nearly prefer writing a note in my phone, and I know that sounds really lazy, but I'm going to be really honest with you. However, what I have noticed, and in our app for our MS to Success programs, we have food, mood, sleep, and symptom journals. And this is where you really go deeper because you can write in what you've eaten, what symptoms you've experienced, how you're feeling, and also you can even take pictures of your food because I'm too lazy to write in all the food, and who needs to be doing that? But even if you did that somewhere for 7 days, you will see those patterns yourself before anybody else will notice them. So, you'll notice when X flares after Y, or I think the bigger trigger might be Z. So really invite the collaboration. And when you show up, and this is what I invite all of my clients to do at the beginning before they work with us, we want to get a snapshot of what life looks like right now before they change anything so that we can see the gaps. We can see where things are maybe working really well already. And then we can see where some things could make a really big difference for them because we don't want to throw the baby out with the bathwater. So for your own appointments, really set yourself up to succeed and take some notes before you go because most of the time with a doctor, when you go to them, they're going by what you say in those few minutes. And if you don't have a clear picture, and a lot of times I don't have the clarity when I'm feeling unwell or when it's gotten to the point where I need medical attention now, or if I have a temperature or dealing with a chest infection or whatever it might be, you don't necessarily have that clarity to give to a doctor. So having those notes in advance of that can make a big difference for you as well as your practitioner to give you more specific advice. This episode of Talk Healing to Me is sponsored by Clean Boss, created by Joy Mangano, the legendary inventor behind the Miracle Mop and a pioneer in clean innovation. Clean Boss is a botanical disinfectant that kills 99.9% of viruses, germs, and bacteria. It's safe for food surfaces, soft surfaces, and baby high chairs with no toxic ingredients and no rinse required. It's also a degreaser, odor eliminator, and all-purpose cleaner that works as hard as the chemical heavy stuff without the health risks. Check it out at getcleanboss.com/Karen for a clean, better, and living safer life. The sixth point is wholeness is the goal. So you don't want life organized around symptom management. You want your life back. So wholeness means care that respects your biology and the psychology and your values. So one of the things that Dr. Kelly and I had spoken about before was the North Star outcome. So what is it that you want from this appointment? Is it that you want your energy back or you want to feel, steady energy to work or to parent or to walk 5K pain free? A lot of times when clients come to me, they want to participate in life again or they want to go on a holiday with their family and not feel that they've to, or that they're going to hold anyone back, or they want to be able to deal with heat sensitivity, or they want their confidence to be able to go for a promotion in work. So measure all the advice against that goal that you have specifically for you, because a lot of the times, maybe your practitioner might think that they know what your goal is. A lot of the times, I will get people that show up with the same symptoms and maybe a similar presentation of how they feel, but their goals could be completely different. And I'll give you a specific example. We had one client who wanted to move house, and she lives by herself. She wanted to move house. She had exactly the same symptoms as somebody else that started about 3 weeks before her, and they just wanted to keep their job. So she wanted energy that lasted, all the way through the day, but she wanted energy at the weekend to mind her kids and to spend time with her husband at the weekends. And this other person wanted to be able to move house and not have a relapse. So it's really, really important that you make sure that what you're living into and the things that you're doing are aligned with what advice you're given, or making sure that you are aligned on those goals. The seventh point was biology matters. So standard doesn't equal right for you. And it's kind of moving on from the point that we just said. So one of the things that Dr. Kelly Blodgett mentioned was from mercury to fluoride to dental materials, your system may react uniquely, and personalized care lowers your inflammatory load. So, you can ask about the safety protocols or, particular ingredients within whatever, if you are being prescribed something or if there's particular materials being used, but also the information that you're getting, whether it's a prescription, a medical prescription, or whether it's, physio, make sure that it is aligned for you. Again, female bodies are very, very different to male bodies. Make sure that it is aligned with your hormonal cycle, with your energy levels, and with your time that you have available to do something. There's no point in somebody giving you something that you need to do 5 times a week that's going to overwhelm you if you haven't got the time or the mental space or capacity to actually even take that on. So make sure that it is aligned specifically to you. The eighth point was partnership beats hierarchy. What does that mean? Well, the best care happens when expertise meets ownership. So providers will bring the skill, but you're going to bring the context and the consent. And this is where healing really lives. So, if you're saying, I really want to make this decision together, what are my options, the likely outcomes, and the risks if I do nothing? So make sure that you have all of those things. You don't want to be giving away your sovereignty and just saying yes to everything that this person says. You want to make sure that you are exploring what the actual options are so that you feel safe and secure in what is being advised to you. So, number 9, future care must balance science and humanity. So, we need providers to be fluent in, reading labs as well as listening, and really bringing in the psychology as well as the diagnostics. So, having that empathy and evidence should really share this wheel of care. So, it's okay, to ask your provider to take account of your goals and your beliefs and your time that you have available to do this, and make sure that that is incorporated into your plan. Really don't be afraid to do or to ask for that. I'll give you an example. In our MS to Success programs, we have a lot of people who are on medication. And I say it's probably 50% of people. It's probably a 50-50 split of people who are taking medication and 50% of people who are not. And they will all have different beliefs about why or whatnot. And it is important that each person is validated and that they feel that they are listened to and that is incorporated into their personalized plans as well. Because otherwise, if you're trying to follow cookie cutter advice, it doesn't feel supported. I wouldn't feel trustful if somebody didn't take my needs into account. Again, like I mentioned earlier on, we have to get to know someone, what their lifestyle, their pattern, their food, mood, sleep, and symptoms are before we give them any suggestions or a plan. Because again, we don't want to give some random cookie cutter advice to someone who might be doing great things already. We've got to incorporate all of that in there. And your doctor and provider, no matter what it is, should be taking that into account as well. So, again, circling back to the point I said earlier on, do track those things before you go into your doctor so they can get a sense of where you're at and give you more specified advice. Okay, the 10th one is hope is rocket fuel. So it's not fluffy, it's biochemical. And when you feel heard and you have a plan and stress hormones drop and healing behaviors stick. So hope really is medicine. So leave a visit with a written plan and next steps and timelines and what success looks like to you and how to get support if you hit a snag. I hope those points are helpful to you. Please do let us know. You're welcome to contact us on social media if you have further questions, or you can email podcast@talkhealingtome.com. And before we wrap up, I want to pause and celebrate some of our client wins this week. One of our clients walked through a shopping mall without needing her cane. We had another client who went from a station in London, one of her goals, and her goal was for January, it's September right now, was to go from the train station to work and back down again. And she did it. She did it herself. I mean, that is phenomenal. We had another client who slept for 9 hours and 45 minutes, which is the longest time she's ever slept. Just absolutely incredible. And another one took her first holiday in years without worrying about mobility or being able to keep up their family. I mean, these are reminders that small steps add up to great big transformations. And if you're listening today, let these wins inspire your own step forward. And there you have it. our top 10 takeaways from Dr. Kelly Blodgett's interview. And here's what I want you to remember. You are in charge of your health. You deserve to feel informed and empowered and heard every step of the way. If you're dealing with MS, you are more than welcome to come in, take our assessment, see if, how and where we can help and where those blocks might be with your health. Go to ms2success.com. And if this minisode has sparked something for you, share it with someone who needs some encouragement, or subscribe so you don't miss the powerful conversations we've got lined up. As always, keep choosing healing, keep choosing hope, and keep choosing you. I will see you next time. Thank you so much for listening. Goodbye for now. Thank you to our sponsors of this episode. You can visit getcleanboss.com/Karen. And also a thank you to our video and podcast producer and editor, Aoife McNamara at Imagine Media. Thank you.